Good afternoon, everybody. I'm Dr. Almina Free. I'm Vice President of Medical Affairs and Chief Medical Officer at Regional Medical Center and Stringfellow Hospital. I'm also internist by training, and I practiced in internal medicine for 19 years in private practice. I then moved to the hospitals to work as a hospitalist, and am presently working as a hospitalist. I wanted to just say thank you for listening to us, and we appreciate your comments. I just wanted you all to know that we have all been called by a higher power. God directs us. We answer to Him, first and foremost, and we love our community. I've been here longer than I've ever lived anywhere else and plan to die here, and pray the Lord continues to use me as He's using me, because this is my calling. So the last time I talked, we had a little bit of feedback regarding information. So I have statistics and must read them because I don't want to give you any erroneous information. I have received my information from Alabama Hospital Association and the EMA, and just our experience here at the hospital. So in Alabama, as of yesterday, there were 5,206 new confirmed COVID cases. In Alabama, the test positivity rate is still only 22%. We have had greater than 880 confirmed COVID positive cases in ICUs in the state. 54% of all ICU patients are COVID positive. Greater than 607 vents have been used and are used presently for confirmed COVID positive patients. 42% of hospital vents are available. For ICU beds available, minus. Say this again, ICU beds available, minus. There are a few areas that have some beds available. We are not one of them. We are working very diligently to move our patients, and this is what we do all day and night long. In Calhoun County, there have been greater than 17,858 total COVID cases. And if you see this visual, as you see where COVID began, with the COVID positivity rate, you will see that there is a huge incline. And this is statistically obtained through the EMA for you to see. You can go to the website, calhouncountyema.org, and read more about it. At RMC, as of today, we have bedded in our 3 COVID units 57 patients. We have a total of 190 or so patients in-house, whether it's same-day surgery, postpartum, ICU, 9th floor, all the way down to PICU. So 57 of those patients are in our COVID units. In our COVID-1, which is the critical care unit, we have 15 patients in ICU, that 7 others are medicine in that unit. Of those 15 ICU, 15 are on vents. In our regular ICU, we have 11 patients. Of those 11 patients, 10 are on vents. In our ER, as of maybe an hour ago, we have 10 patients waiting to be bedded. 7 of those are in need of ICU beds. So if you look at the math to adjust, we're COVID heavy, ICU heavy, critical care heavy, vent heavy, and if you look at the rest of the country as well as our state, every state is dealing with the same problem. Very, very critical, ill patients. At Stringfellow, we have 1 COVID patient waiting. In our deaths over the last night, we had 2 deaths last night, 1 death this morning. And the deaths as of August, we've had 37. At the beginning in April 14th, which was our first reported death, we have had 253 deaths. So people, please, again, begging you, do the right things, wear your masks, vaccinate, stay healthy. We can't stress that enough. The illnesses are taxing the hospital systems everywhere, not just this country, but all over the world. Thank you.
Hey, I'm Michelle with Infection Prevention. Just want to give you a couple of numbers. I think Dr. Free touched on a few of them already. As of this morning on our COVID units, our 3 COVID units, we have a total of 57 patients. Of those 57 patients, 49 are not vaccinated, 4 are fully vaccinated, and 4 are partially vaccinated. The average age range of our patients on the COVID units is 19 to 94, so that gives us an average age of 56. 15 of those patients are in the ICU and on ventilators. 13 of those 15 patients are not vaccinated. 1 is fully vaccinated, 1 is partially vaccinated. The age range is 26 to 92 with an average age of 61. And this morning we did have 10 COVID patients waiting in our emergency department to be admitted. 6 of those were considered a medical admit, while 4 of those need to have ICU beds and 1 is on the ventilator. If you need some vaccine information, our Moderna vaccine is available every Thursday at the Tyler Center on the 4th floor from 8 a.m. to 10 a.m. This is no appointment necessary. You can just show up. On Fridays, the Pfizer vaccine is available for ages 12 and up. So every Friday at the Tyler Center, 4th floor, from 8 a.m. to 10 a.m., no appointment necessary. You can also go to vaccines.gov and register that way for a store in your area that is providing a vaccine of your choice. Testing information, we do provide COVID testing available at the Oxford Metaplex. That is Monday through Thursday, 8:30 to 3:30, and Fridays from 8:30 until 2. This is by appointment only, so if you need to schedule an appointment for a COVID test, the number is 256-235-5600. Please leave a message at this number. They will contact you back and set up an appointment time for you to come and be tested. The Calhoun County Department of Health provides COVID testing Monday through Friday, 9 a.m. to 11 a.m., no appointment necessary. And they also offer the vaccine Monday through Friday, 9 a.m. to 3 p.m., no appointment necessary. Please remember that our emergency department is not a testing facility. It is for emergent cases only. Thank you so much.
Hello everybody, I'm Dr. Patel. As you all know, as Christine mentioned about me, I'm the pulmonary critical care and a sleep physician for 26 years here in Anniston. As soon as I graduated from my UCSD school, I've been practicing 95 and I'm here since then and love practicing over here. I thought every time I give you some update, I give you some suggestions about community, but since we are extending outside our Calhoun County community, let me just explain everybody in a community how the flow works in our system over here. First of all, we have a team, as you all can be aware of it, is emergency room. It starts from emergency room, then it comes to ICU, and then once it comes to ICU, we have a team of 4 of us, pulmonary critical doctors, 4 nurse practitioners, and anesthesiologist who helps us out in between if we need to. So I can thank all this team that hard work. I cannot forget thanking all the people who actually do the work, hard work, which is nurses, respiratory therapists, and all the staff who comes in the COVID unit to clean the unit, secretaries, etc. Pardon me if I forget anybody, but I thank everybody for this. But the way it works is that people typically get COVID, and usually 95% of the time, thank God it's only not that many times, people are okay. But those 5% of people who get severity of the COVID-19 infection, especially the lung infection, usually starts getting worse between day number 7 to day number 15. And in the beginning, they come in, they're assessed by the emergency room physicians. If they need oxygen, we put them on oxygen. Sometimes we send patients home thinking that they're stable enough. They come back within 2 to 3 days again, and we have to put them on ICU and potentially on a ventilator. But most of the people who come in the emergency room are sick enough, and they get admitted. The flow goes through that. Initially, they go on the medical ward. All the primary care docs take care of them. We are in the backup to observe them. And then most of the time what happens is people have what is called as a cytokine surge, They're talking to you fine at one moment, and 2 hours later they become really tachypnic, meaning by they become very short of breath, hypoxemic. And we have different means of giving oxygen to everybody. It starts with a low flow nasal cannula. It starts with high flow nasal cannula, and then it goes on a BiPAP. And if the BiPAP does not work, then we end up putting them on the ventilator. That is how the flow goes in, and all the team is available at every step, every moment, including my team, and everybody is available 24/7, so patient's care is not being compromised. So that is the whole flow of the patient, how it works, and there is everybody at each and every step to take care of the patients. So I want to reassure the community that patients have been taken care of as they need to be over here. Once they are in the hospital, they are being started on appropriate antibiotics. Dr. Magadi and his team works together to put people, make sure they are started on all the medicines we use for COVID-19, which are approved or EUA, but we don't use any other non-approved medicines. Also, we empirically cover them with antibiotics, and once they go on a ventilator, the respiratory therapy team has the orders for spatial orders where we use different strategies to get the oxygenation better. We already have been using different strategies, and there are potential complications of each and every strategies. We look for those complications and try to make adjustments. And then a team, we make rounds every day with all the team, pharmacists, etc., to make sure all the medicines have been appropriately given, doses have been adjusted, all those things like requirement for patients, taking care of the patients. So basically, that's the whole flow of the critical care patients, and that's how it works. If you have any questions, you can always ask, and we will be happy to tell you, because we are very transparent. We may not be able to reach the family members right away because we are taking care of so many patients. For instance, right now, we have 4 nurses in ICU per one nurse, 4 patients per 1 nurse, which is a very high ratio. Unfortunately, that's what we can do at this time. We are trying our best. They are on the edge. They are working hard. They are trying to give dedicated as much they can, but they are doing their best. And then patients have survived. The most people who have survived are not gone on the ventilator. So when I make my rounds, people are requiring a very high oxygen. I tell them to make sure they sit in the chair and move around in the room, no matter how much bad they feel. And those are the people, I have at least 15 of them on the floor right now. They have made it and they went home on oxygen. So we tell our patients to stay out of the bed and stay in the chair and the recliner as much as possible. That is the best way to not go on a ventilator. And after that, we watch for the complications. Like I said, there are people who survive and they go to other facilities, or they come from other facilities over here. They have complications of infections, secondary infection with gram-negative infection in the lungs, UTI, blood clots, etc. goes along with that. We pay attention to minor details to take care of them in a timely manner. So that is what I want to thank everybody. I just want to have community to have the feel for it, what we do over here. And I'm going to hand it to Dr. Magadia now. Thank you.
Good afternoon. I am Raul Bagadia. I'm an infectious disease specialist, and that's what I do exclusively. For the most part, I do hospital care, mostly inpatients. I do have a general ID clinic, 1 morning a week, and I do also wound care, on top of being chairman of various committees, including infection control, antimicrobial stewardship. I came here from New Jersey. I did both my internal medicine residency training and infectious disease fellowship at Rutgers University in New Jersey, about 45 minutes from Manhattan. Somehow we ended up in Michigan for about 3 years. We did not like it because it's cold. And Alabama, with its almost tropical weather, has been home since 2005. Okay, so what I'm here to talk about are 3 small things. Number 1 is masking post-vaccination. There's a lot of issues about, I've been fully vaccinated, I got my 2 shots, Pfizer, Moderna, or got my 1 shot of J&J. Why do I still have to wear a mask? The second topic that I want to briefly talk about is I've had COVID. Why do I need to get vaccination? And when do I need to do that if I want to? And thirdly is the question about, most of the people sick in the hospital or sick in general, they're not healthcare workers. So there might be some kind of conspiracy that the only ones getting sick are people not in the medical field, which is completely false because we've had also people from healthcare field getting sick with COVID. So diving in, so masking, the number one topic is masking post-vaccination. So I'm going to quote my good friend. He's a tenured professor at UAB at the Division of Infectious Disease at University of Alabama in Birmingham. His name is Peter Papas. I've known him several years now. We do some work together at infection control and antimicrobial stewardship here in the hospital. And and I'm going to quote him directly. Among ID practitioners and public health professionals, there is no mask controversy. Masks work. Not 100%, but they significantly decrease transmission of respiratory transmitted agents such as TB or tuberculosis, influenza or the flu, and SARS-CoV-2, which causes COVID-19. And end of quote. So, case in point, here in Calhoun County, with a population of 114,000 in 2019, we had three cases, reported cases of new tuberculosis. So that's about 2.6 cases per 100,000. That was in 2019. In 2020, last year, there were only 2 reported TB cases in the whole of Calhoun County. So the rate went down from 2.6 per 100,000 to 1.3 cases per 100,000. Not a lot of difference. So from 3 cases in 2019 to 2 cases. So you could make an argument that's a little bit of stretch, Dr. Magalia. So another point, the flu. In 2019, we had 292 cases of influenza severe enough needing to be hospitalized. Back in 2020, the whole of 2020, the whole flu season of 2020. Those cases dropped from 292 cases in 2019 to 8 cases in the whole of 2020. So the significant difference from 292 to 8 cases. So the only thing that we did was, we told people, you get vaccinated, social distance, and wear mask. So the mask works. So where is the controversy? So a lot of people are saying, I'm vaccinated, I don't really need to wear a mask because 94, 96% effective, right? You've been telling us that. So I told you last week about the Wisconsin paper and the Singapore paper. So the Wisconsin paper, or Wisconsin study showed, there are 300 cases that they collected in June, July. And of the 300 cases, about 79 of them, about 80 of them were vaccinated, and about 220 something were not vaccinated, and all of them got the COVID. So they found out that equally of the 300 who got infected, either vaccinated or unvaccinated, you have high viral load in your nose. Viral load means the number of infectious particles of the SARS-CoV-2 virus that is able to be transmitted and therefore infect everybody else. Equal number. But the Singapore paper suggests that amongst the two cohort, the vaccinated versus the unvaccinated, the vaccinated group clear and decrease their viral load much faster with a difference of about 2 or 3 days. So although you are vaccinated, you could still get infected because these vaccines that we have, all 3 vaccines available here in the United States, they're not transmission blocking vaccines. They're only disease modifying vaccines. So that being said, although you're fully vaccinated, I think those non-pharmacological measures that we recommend, wear your mask, social distancing, and wash your hands, and all those things still apply whether you're vaccinated or not. So because we've been asked before here in the hospital or even the community about the vaccination and wearing masks. So I hope that kind of settles that. So we're still recommending here in the hospital, especially in the hospital, that everybody wears a mask, especially when they're dealing with patients. The second topic that I want to talk about briefly is vaccination post-COVID-19. So pre-Delta, the line of thinking was, it takes about 90 days for the neutralizing antibodies to go down. So you're kind of protected against that particular strain for about 3 months or 90 days. That was pre-Delta. So Delta happened early summer. So that recommendation obviously changed. So the kind of soft recommendation by CDC and FDA is if you're out of quarantine and your symptoms are resolved, typically 2 or 3 weeks or 4 weeks, you could avail yourself of a vaccine after COVID-19 infection. So what we do here in the hospital is those people we admit, and by the way, about 92-91% of people that we admit here in the hospital are unvaccinated. So when they're about to be discharged, we recommend that you wait at least 4 weeks after you got infected, after which you could avail yourself of the COVID shot, whether it's Pfizer, Moderna, or J&J. So pre-Delta, we were recommending 90 days or 3 months. Now that Delta is here, we're kind of recommending 4 weeks or 1 month. Okay. So lastly, the question about you guys are not getting infected. It's mostly non-medical people getting infected. This is a question asked by my sibling back home in the Philippines, so shout out to her. Go to sleep, by the way. It's 13 hours. They're 13 hours ahead, but I think she's watching. But take care of that. COVID-19 among healthcare workers. So there is a study called COVID-NET, N-E-T. This was published on MMWR, or Mortality and Morbidity Weekly report. This is 13 states. And so what they found out is of the people who got infected, about 6% of those work in healthcare field, including nurses, physicians, techs, respiratory techs, and all those things. So we are not immune to this. I have personally known healthcare workers who got sick, and unfortunately, we actually know a dear friend of ours who did not make it with the COVID-19. So of those 6% healthcare workers, about 36% of them work in the nursing field. So nursing related, either CRNP or nurses or nurses aid, about 36% of them. Of those people, 28% of them end up in ICU. And of those, 16% end up on the vent. And unfortunately, about 4% of them died as well. This is from the COVID-NET study published in MMWR, so I'm not making this up. So there's another survey that was done by AMA, or American Medical Association. This was back in early June among physicians. So among physicians, about 96% of them have been fully vaccinated. Of the 4% who are not vaccinated yet, about 50% of that 4%, about 2%, are intended to get vaccinated sometime soon. So if 96% of physicians, and we think that we kind of have some kind of a headway in studying this, years and years from college to med school to residency and fellowship, we kind of have some leg up or head up on the knowledge and experience in this kind of diseases. If 96% of those people are vaccinated, I think there's some kind of credence to the vaccine. We think it's safe. We think it's effective. That's why we have it. And that being said, I'm going to turn the floor to Bridget. Thank you.
Hello, I'm Bridget McGuirk, Director for Occupational Health and Wellness at RMC. RMC did open the antibody infusion area today for mass infusions for the public, for the community. We'd like to take this moment to thank the Anniston School Board and our community partners. Without them, this wouldn't be possible. I am going to go over some FAQs today about monoclonal antibody scheduling, not the actual infusion process or the injection. Just some questions. How do I go about getting the antibody treatment? You need to notify your provider, and he will send an order to RMC so that we can get that rolling for you. Will I receive a call, or should I call? No, we will call you. Just answer the phone when we call from an unknown number. Where do I go once I get the appointment? You're going to go to 1325 East 10th Street, Anniston. Pull in the front and we'll assist you from there. How long will I be there? You're going to be there about an hour and a half. Can you bring something to drink? Yes, bring something to drink. Can you bring a snack? Absolutely. Can I bring someone to sit with me while I wait? That will be no. Almost all that are in that area are positive patients, and they are contagious. What should I wear? Loose clothing or removable clothing. I'll leave you with this. Do not wait. Vaccinate. Or we'll see you soon. Thank you.